everyone. Today on this edition of Ask Monica, we're going to talk about how long after having a baby can you safely do another embryo transfer? A common question that we get, and a good question. Currently, our governing organization, American Society of Reproductive Medicine, or ASRM, doesn't really have guidelines on this. So they are somewhat center specific. But the American College of Obstetrics and Gynecologists, ACOG, does, and their recommendation is after the birth of your baby, is to wait at least 6 months before getting pregnant again, and preferably up to 18 months. So their recommendation is no less than 6 months and ideally 18 months. For us in reproductive medicine, we know that some of our clients start off having their first baby a little bit older than women in general. When women experience infertility, they might be a little bit older. We also know that it may take you a little bit longer to conceive than people that haven't experienced infertility. So what our recommendation is if you have had a vaginal delivery, so not a C-section, but any vaginal delivery, we would like you to wait at least 9 months prior to doing another embryo transfer cycle. If you have had a C-section, we want you to wait a year. Having another baby too quickly after a C-section might put you at risk for some other additional complications, such as your uterine rupture and other complications of the uterus due to having a pretty profound uterine surgery by the C-section. The other reason to wait is to rebuild your vitamin stores, start going on folic acid or prenatal vitamins if you haven't taken them. And as always, we feel like prior to pregnancy, it's a great time to try to optimize your health. So if you have any conditions like prediabetes, high blood pressure, anything like that, we want you to kind of be working on with somebody on them. If you're taking any medications, are there any medications that you should be able to wean off of? Or should you switch to medications that are okay in pregnancy? A lot of antidepressant, anti-anxiety medications may need to be switched to a safer medication for pregnancy. If your BMI is too low or too high, according to the BMI chart, which is not perfect or ideal, it's just a standard chart, but if you fall either on the very low or the very high part of the BMI chart, it's an ideal time to work with somebody or on your own on having a regular movement practice and really trying to eat and move in a way that your BMI can kind of comfortably settle wherever your set point is going to be. So those are our recommendations. Like I said, we know that people that come to see us are a little bit more anxious about starting sooner rather than later, so we do take that into account. But the ACOG recommendations are what most fertility centers follow. And so if you do want to start at some point before 6 months after having your baby, it's unlikely we would want you to do that for your own safety. So thanks so much. Continue to always email or send in your questions for this platform. Happy to answer them. And good luck with your fertility journey.